Good morning. My name is Erin Hamilton. I'm a family physician in North Battleford, and my quality improvement journey led me to attempt to increase the offers of HIV tests that are offered in the Battlefords. The current state is that Saskatchewan has shockingly high HIV rates. We know that testing is the first step of having people living with HIV enter into the treatment cascade. We know that simply testing, increased testing, has been associated with decreased transmissions of HIV. And we know that HIV testing is cost-effective. And we have strong guidelines that emphasize that patients presenting for primary or emergency services who do not know their status should be offered a test. So, like Coco, I thought, hey, we've got an effective solution to a known problem. What could possibly go wrong? Our team enthusiastically set a goal of increasing the tests by 50% by November of this year. We started out by trying to learn a little bit more about provider knowledge, attitudes, and beliefs. We did a survey and spoke to different providers in the city, and we found that physicians and NPs basically did feel that HIV testing was important, but there were barriers. Most commonly listed were time constraints, lack of familiarity with pre-test counseling, and lack of familiarity with the referral process for positive results. We did find that 95% of providers would be more likely to offer testing if there was a policy in place for follow-up. And the emergency room staff were very succinct in their concerns, and that was time for counseling, the follow-up of positive results, and the more philosophical role of should we be offering a non-emergent test in an emergency care setting. So armed with that knowledge, we were able to go on and develop some interventions. The first thing was to develop a policy and procedure that details how positive results will be followed, specifically when the ordering provider is not the primary care provider. We slightly modified the patient information sheet put out by the province to be a little bit more applicable in routine testing situations, and we made sure the providers were familiar with this as an efficient way of providing good pre-test counseling. Our walk-in doctors jumped right on board and started offering HIV tests to any patients that they would be sending for blood work anyways, and they found that the patient acceptance of the test was really good. Our emergency physicians will be offering HIV tests to patients having blood work done, and our general surgeons will be offering HIV tests when booking patients for elective surgery. So we didn't quite meet our stretch goal of 50%, but we have seen an increase. But from this run, you can see that this is still a very unstable process, and we need to do a little bit more work to learn a little bit more about the causes of variability. But I do want to highlight our HIV testing superstars in this case is our walk-in clinic docs, who have done a fantastic job of offering the test. What's next is to establish some standard work for the ER surgery and inpatient medicine, as we're still in the PDSA kind of phase for those areas. Continue to find opportunities for testing in primary care. We want to monitor our balancing measure, and that was to ensure that patients who do test positive are connected to care and receive appropriate referrals. And we want to learn more about the factors that influence patients in either accepting or declining the test. But I can say truly that the past year was not just about HIV testing. I learned so much about communication, teamwork, and that's changed the way I look at my daily work and the system that I work in. Thank you.